Laparoscopic intragastric surgery, also called laparoscopic endoluminal surgery, is a good minimally invasive option to treat those gastric lesions that are difficult to resect endoscopically, resulting in a good surgical strategy for lesions located at the posterior wall of the stomach in cardiac or pyloric regions. We present a video of 68 years old patient with a 5 millimeter lesion in the subcardial region with a pathological diagnosis after a double endoscopic biopsy of high-grade dysplasia. After a first attempt to perform an endoscopy-assisted wedge resection to locate the region, as you can see, it was impossible due to the anatomical location of the lesion. We decide to convert to an intragastric laparoscopic approach, always guided by endoscopy. We use balloon trocar in order to approximate the gastric wall to the abdominal wall. If not, it's impossible to work inside the stomach. And one time inside the stomach, the endoscopy show us the lesion to resect. As you can see, maybe the most difficult part of the intervention is just to put inside the stomachache trocar. But step by step, it's not so difficult. And I was telling one time we are inside the stomach. The endoscopy shows us the 5 millimeter lesions. And then we resect the lesion with, in this case, with ultrasound dissector. Most important things, as you know, is to perform the resection with good margin, good lateral and deep margin. The ultrasound dissector perform a perfect hemostasia. As you can see. There is no bleeding at all. And then we take advantage of the endoscopy to remove the specimen. After that, we close the bridge. We close the 5 millimeter bridge with running suture using barbed suture. We think it's at the moment the best suture to use when you have to do a running suture. We use the needle and we find the needle. We close the other 5 millimeter bridge with another running suture, barbed suture. And then, as you will see, we decide to close the 10 millimeter bridge with an endogia in order to be faster, to finish the operation faster. So we can say that the final pathological result was high-grade dysplasia with free lateral and deep margins. And what we can say is that among minimally invasive hybrid technique, intragastric laparoscopic surgery represent a valid option for the treatment of gastric lesions that do not have an indication for endoscopic resection due to their location. When correctly selected, the laparoscopic endoscopic approach is considered curative and safe for resection of localized gastric tumor. Thank you very much.